Welcome to the Goth and the Sloth. I'm your Sloth, Matt.
And I'm Luna the Goth.
This is the podcast of two friends living a country apart, living our best lives, and getting into the Christmas spirit.
Uh,
Are we?
are we?
I think we are. We decided to take the first part of our podcast to talk about the COVID-19 pandemic, how it affects our lives, how it affects your lives, and how it's just the worst.
Yeah.
Just
Yep.
the worst.
Consistently. Like, really. I
Always.
mean,
Yeah. So how have you been?
cold. I've been very cold.
Me too.
And I'm not mad about it. I know that you typically get mad about being cold, but I like being cold. I just I my fingers and toes are cold. I just want to stay in bed. Is my
Yeah.
problem.
Yeah, no, I deal with it better inside than outside.
Weird.
At because I can get under a blanket and you know get warm. But yeah, when you're outside and it's just like a bitter wind, and I'm trying to just do my daily walk, you're like, I hate everything.
Oh, yeah. Yeah, I could see that. But you're so bundled when you go outside. So you're like, I'm almost warmer outside than I am inside because inside I have this like weird idea that I shouldn't wear a coat.
Oh, so I got
But
to get a house coat.
yeah, I know. It's hoodie weather. I've been in hoodies, I'm in sweats, I have wool
Yeah.
socks on. Pretty happy about it. But yeah, I just keep waking up and going, my toes are cold.
Yep. And I don't want to get out of bed.
Yep.
It's cold out of this blanket.
Hmm.
But I gotta pee. Think,
Or
think,
the
think.
cat will murder me if I don't feed her.
That's Mine will just keep booping my face until I get out of bed.
Aw, yay, kitty.
All right, so let's get into it. How is the Greater Virginia area doing?
Awful, just like always. So we
Yeah.
have 247,380 cases as of today, which is up 14,000 since last week, and we have 15,116 hospitalizations, which is up almost 1,000 from last week, and we have 4,160 deaths, which is up about 110 from last week. So
Wow.
like, yeah, I mean, we're in it and it's getting worse.
Yep.
So and we have 11 cases of multisystem inflammatory syndrome in children.
No
So
bueno.
yeah, it's just I'm like, I don't know what the word is. Not anxious, but like I'm dreading the next week's numbers and the
Yeah.
week following after Thanksgiving. Like,
Oh, it's gonna be bad. Absolutely.
yeah, I'm not happy, which is an understatement, but still.
Yeah.
What about you? What's Colorado doing?
Also terrible. So we are at 252,222 cases, which is up 30,000 from the previous week.
What?
Yeah, I had to double check, triple check. I'm like, my brain can't even compute that. But
Whoa.
that's last week we were at 220,000. Now 250,000.
Huh.
Wow. Yeah.
This is just
Um,
nuts.
it's insane. 14,762 hospitalizations, up 1,000 from week to week,
Yeah, wow.
and 2,724 deaths, up 203
Oh
from the
my
previous
God.
week.
What is happening in Colorado?
I don't know, but it's bad.
Holy shit, that's terrifying.
Yeah, we've gotten really bad.
I
So, yeah.
I like so many people that live in this world. I don't want everyone to die. God damn it. What the hell?
I don't know what's specifically causing it, or just I don't know. It's crazy. But yeah, we're still under the full lockdown that I mentioned last week, except for retail, and
Of course.
outdoor dining. So not
They'll never
really.
shut down Walmart.
Oh, absolutely not. Yeah.
God
Um,
damn. That
our
is nuts.
governor.
You've
Oh, good.
overtaken us. Like
Yeah.
you have more cases than Virginia.
Yeah, and
Like you've
the
definitely spiked recently.
in about a month too. Not a very long time. You were kind of ahead of
No.
us, and then all of a sudden, we took 2 weeks off, and in that time, and the time we've been back, we've already just way overpassed you.
God damn.
So yeah, and our governor and the first gentleman have both tested positive for COVID.
Yeah, I saw that. Oh.
So that's not good. I also like the fact that it's called first gentleman. I've never heard that, and that's kind of
Yeah,
great.
yeah, it's there's like this whole thing going around of like what is Kamala Harris's husband going to be called? And it will be cuz usually,
Is it the second
it's like
lady?
second lady. So it's going to be the second gentleman. We'll have
The
a first lady and a second gentleman.
second, second lady sounds like a terrible title though too.
Oh, totally. I all of these titles are stupid.
They are,
Like just take a minute.
but
Just listen to ourselves. But
but
I
yeah,
I do think it's funny that it's like first gentleman,
the
second
first gentleman. I think we should start just ranking every man and just
Oh no.
I'm the 2307th gentleman.
Oh. Oh no. That sounds terrible.
So in world news, the CDC has suggested a shorter quarantine time based on no additional science. Just
Yeah, I saw that.
I mean, it doesn't. Their understanding doesn't sound terrible, but yeah. So it's 10 days, and if you haven't gotten any new symptoms, um, like if you haven't developed any new symptoms, 10 days into that, it still seems not great.
Well, they say that like they're shortening the quarantine time, but they're still like, well, if you shorten the quarantine time, then you definitely need to take a test at the end of that, even if you don't have symptoms, just to make sure, and then you can go out.
Yeah. I don't have his name. I thought I had it, but professor from Harvard is giving them a lot of shit, saying basically they're addressing the fact that people won't quarantine by just making it shorter instead of addressing the fact that people like giving things so it makes it easier for people to quarantine.
100%. Absolutely. I agree with that 100%. Like, I think that they are just saying basically, like, well, people aren't quarantining and they want to travel, so let's try to get them to half quarantine. It's like half quarantine doesn't work.
Yeah.
That's why it's called quarantine. God damn it. Like, yeah, I totally agree with that, professor, based on what you just said.
So yeah, that's what's going on, um, and everything is terrible.
Mhm. Mhm. Oh, and just for the sake of timestamp on the podcast, so that in the future we'll be able to look back.
Sure.
But uh, the UK on Wednesday this week did emergency approval for a vaccine, so that they're the first Western country to have a vaccine. We'll see how it goes.
Oh yeah, that's good to mention. I kind of forget some of that because I still don't believe it's happening. But Colorado's supposed to get the vaccine in like a few months, supposedly.
Yeah, everybody's supposed to.
Yeah, so I mean, we'll see. There's also an
And
article.
by everybody, I mean all the states are supposed to, but
Yes.
they're going to go to first responders first.
Yeah, it goes to the people that need it first, hopefully. There's another problem though too, is that one of the vaccines that's gotten approval is a multi-dose vaccine.
Both of them.
Oh, they both? Okay.
Yeah, they
And
both require two shots a month apart.
yeah, and they're saying if you don't get the second shot, it could make COVID resistant to this vaccine.
No, motherfuck. Come on.
Right. And one person posted on Twitter with that article, with a great GIF of Ralph Wiggum saying, "I'm in danger."
Yes. That's fantastic. Oh my god.
So I guess if you get the vaccine, make sure you get your second dose as soon as like as
Yeah,
soon as you
just like
can.
actually listen to the doctors. You're not smarter than them, okay? Just do the thing. God.
So what's going on in Luna's world?
Well, I am back at like full-blown work schedule, so that sucks. Kind of liked that time off I had.
It's always nice.
Yeah, so I mean it's good. I'm happy to be back like working. It's definitely rewarding and but I'm tired and like sitting up at my desk for a really long time takes a lot out of me for
Hmm.
some stupid reason and I guess it's because I might still have holes healing, blah blah blah, whatever. But like um I'm feeling pretty good. Like I feel pretty fucking good. I just
Good.
am tired. Like really tired.
Yeah, it'll take a bit
Um
for you, especially because you're used to being able to be all nimbly bimbly and flexible.
Totally. Yeah, like I'm doing this like handstand advent calendar challenge and I did the first 2 days. The third day I was like, "Oh, I don't know about that." Today's the fourth day. I'm gonna try. It's just like my body is still strong. Like I can
Hmm.
still hang out in a plank. Like I feel pretty good doing a lot of things, but it's just like weird stuff like hanging from something, which is a primary thing that I do,
Right.
doesn't feel good. Doing a push up, like the down and the like going down from the plank and going back up feels terrible. But if I can just hang out at the top, I feel great. So I don't know.
So yeah, it's just when you engage your core, it sounds like.
Well, I mean, my core is
Yeah.
engaged when you do a plank, or it should be. If you guys are doing planks and you're not engaging your core, anyway, whatever. I'm not being paid to teach right now, so.
I don't think I've ever told you though, but that ad you did for your friend's company that you posted the picture for,
Which,
the underwear ad.
oh yeah, yeah, yeah.
You look buff as fuck in that, by the
Oh,
way.
thanks. Yeah, I was like, I looked at that and I was like, dang, got guns.
Right?
Pew pew. My biceps were like on fucking display. It was pretty funny because I was not expecting that, but turns out I got biceps, y'all.
Yeah. Don't mess with you.
So yeah, how are you? What's going on in your world?
So let's continue on with the saga of the stolen car.
Oh yes, the saga.
The saga. So it has been recovered. It was
Yay!
actually recovered 2 days before I knew it was recovered. The cops just didn't bother to tell me. My insurance company told me. So
Cool.
cool. Yeah. It's at the shop right now. It's got an estimate currently around $3,000 of repairs.
Whoa.
So yeah, they smashed the fin at the top. You know, all the new cars have
No.
that fin. They smashed that. Pulled out the it didn't wasn't disconnected, but they pulled out the microphone that sits above the driver's side, so you can talk on the phone.
That's weird.
Yeah, it is weird. The whole thing's weird. I'll tell you some weird stuff here. And then of course they broke the ignition switch when they hot wired it, so new ignition switch. I need a new bumper. They might have screwed that up, and of course the door that they broke open. The
Right,
the
right.
weirder stuff is the car was armor rolled clean and cleaner than when I had it.
Ah, interesting.
Right?
Huh.
Except the back seat. When I finally got in the back seat, they spilled chips everywhere and some sort of weird liquid in the cup holder.
What the hell happened here?
Right? And so many questions. The current theory is maybe they're trying to resell it.
Yeah,
And
that's what I would have imagined is that they were going to try to sell your car.
and
But then why smash it?
so my thinking is they're gonna sell it, and somebody that's smarter than them was like, "Hey, this has got GPS tracking on it." So they just tried to try and smash the fin to disable the GPS tracking. They
Huh.
also either disconnected or stole the battery. I don't know yet. I haven't been able to personally get into the hood,
Uh-huh.
and so I'm thinking they're just trying to find a way so it's not tracked to them once they like figured out like, oh yeah, you can find this pretty easily.
Probably when you kept on telling it to honk.
Yep, I did keep telling it to honk. So it might be somewhat on me, but you know what? Whatever. Cause
Whatever, don't tell the insurance that.
oh yeah. So that's yeah, pretty much what's been going on with me. Just dealing with that and figuring out what else I need to fix, what I need to pay, what needs to go where, and all the fun stuff.
Ugh, God, it sucks. Like, there is nothing else to say about it, really. It
Yeah.
just sucks.
Yeah.
Like, when my car was in a hit and run, they were like, "Oh wow, that sucks that your like side view mirror is just hanging off of your car and your door's totally fucked. That'll be $200."
Yep.
Like what? I didn't do anything. Like
Oh yeah.
my car was parked legally and someone was like, "I don't know, I feel like driving through that car."
Yeah.
It
You don't want to
sucks
get me
so
started on
much.
insurance and how that's a thing.
Yeah. Oh, totally. Yeah, that would
But
be a whole little rant.
yeah, I
Um,
mean, so there's like a lot of little things you kind of forget and still need to think about. Like, they took everything out of the car, as far as I could tell. So,
mhm.
like, I need a new ice scraper. Like, you don't think to ever
Oh
buy
yeah.
those, but it's like, yeah, I'm gonna need that. Uh,
You should get a cool like lightsaber one or something.
I'm gonna go look. And yeah, the mic stand that I used for the show was gone out of the back, so
Right, of
I'll be
course.
ordering one right after the show, actually, because now I got paid. But yeah, fun stuff.
Gross. I'm sorry. I'm still sorry that you have to deal with all of this bullshit. That is,
Yeah, but at
ugh.
least it was recovered. It gives me at least more options to do.
Oh,
If it wasn't
definitely. Yes.
recovered, like there's not a whole lot of options. There's
Yeah.
getting a new car or not having a car. And in
Which
Colorado,
I mean,
not
this would
having
be
a
the year to
car.
not have a car, but yeah, I get it. Yeah.
Yeah,
It's not ideal.
yeah, Colorado's not really built for that.
Yeah. Yeah. Depending
But
on where you are.
this is true.
When I lived in Cap Hill, I definitely didn't need a car, but
Yeah, if you're downtown, probably not. But yeah, I'm like
yeah.
3 miles from a grocery store, so
What? That's just a stroll. You'll be fine. It doesn't matter that it's negative 20 degrees out. You'll
right.
be great.
So
They say that you feel really warm before you die of hypothermia.
it's true. So let's jump into our topic today. What are we talking about?
So, today we are going to discuss the impact of COVID-19 on Native communities and how we can help. So, November was Native American Heritage Month in the US. So, yes, we're late on releasing this episode, but whatever. We'll be discussing Native American communities exclusively. So, but if you live in another country, much of what we are talking about will likely apply to Native communities near you. Um, by definition, Native communities are everywhere.
This is true.
So it's important to recognize the land that we live on and the country we live in, uh, and specifically that the country we live in did atrocious things to
Mm-hmm.
attain that land. And while I'm thankful to live here on this land, I am also sympathetic to the people that have been horrifically treated and then chronically marginalized by the people who allow me to live here.
Yeah.
It's pretty fucked up uh, in general.
Oh yeah, absolutely.
So where I live here is on the Powhatan people's land, and um, I'm actually super jazzed to like look up more about them. Like I researching for this episode, I got so fired up like 40 different times. So I'm definitely um yeah. And I've worked with like when I was in higher education, I've worked with nonprofit communities before that serve native communities, but yeah, after moving, it's like a lot of things slip your mind and it's just not at the forefront, and this definitely helped bring everything back. So I'm happy about that. Um So, COVID, we know that the disease caused by the coronavirus is disproportionately affecting Black and Brown communities. Some people need to be reminded that when we say Black and Brown or people of color, this includes Indigenous people, which is why the new acronym BIPOC, BIPOC, or IBPOC, however you want to do it, is it makes it like that Indigenous is in the name. But generally, like, they've always been part of the conversation, and they
Mm-hmm.
should always be part of the conversation.
Absolutely.
So, Matt, I'll let you start with what are some of the ways that Native communities are being impacted?
Well, it's kind of interesting because, according to an article I found in sciencemag.org, it's hard to get an exact representation of how it's being taken because of, as it says, the virus has taken a disproportionate toll of many indigenous communities in the United States, but its full impact is unclear because of racial misclassification and the exclusion of indigenous communities in data sets. It's
Mm-hmm.
essentially
Yep.
going, oh yeah, they're still here, aren't they? Huh?
Oh my God. So frustrating.
Um, so on top of that, a lot of communities have found ways to make money through ways that aren't necessarily COVID safe, and
Mm-hmm.
it's hitting them financially and medically. So they're getting hit because their communities are small. It's hard to socially distance. They have less access to healthcare at all, and things like that. But also, one community, I'm going to butcher their name, unfortunately. The Halapapi, they are right around the Grand Canyon, and they make a lot of money through a preserve they have that's like a glass walk around the Grand Canyon and
Oh,
all that fun
cool.
stuff. But they had to close that because of COVID, and that's their
Right.
tribe's main source of income. On top
Oh,
of many
Jesus.
tribes have also found getting income through casinos.
Right.
Can't
Mm-hmm.
really have casinos right now in most states. So,
Yeah.
so they're getting hit both ways, and it's really unfortunate from a podcast I listened to from John Hopkins that we actually could have helped them better than any other community
Yeah.
because they have dedicated uh, government areas and government workers, I guess, that are supposed to be involved with them, including
Mm-hmm.
up to medical, and they just didn't do anything.
Absolutely. Yeah. So, I mean, the federal government is responsible for providing health services on reservations. It's as just a reminder to listeners, like especially if you're not in the US, the federal government in the US holds the title to the land that tribes live on.
Mm-hmm.
And uh considering that about 1.5 million Native Americans live on reservations, according to Native Partnership. Um, it's just, it's a lot of people that the federal government is supposed to be taking care of as part of the whole treaty
Yep.
that gives them the right to, not the right to live on a reservation. That's so shitty. But just, that allows them to live on this quote unquote federal land that
Mm-hmm.
is their land, but not even, because so many communities were kicked off of their land to go live on a reservation out in BFE.
Yep.
So I, yeah, I don't know. It's just frustrating. Like, yes, we should have been able to help them the fastest and the easiest because the federal government is in charge of taking care of their health,
Yeah.
and they're not.
They just didn't. Like, yeah, they're already
Yeah.
the built-in infrastructure to go like, hey, we can go test every single one of them because we already have government healthcare and government people on their lands that are supposed to helping them out anyways. And
Mhm.
no,
Mhm. Hmm.
And
Yeah,
so, yeah,
super mad about that.
as he should be. I mean, it all harkens back to the fact that we want to ignore and forget how we obtained our land,
Yeah.
and seeing these people and seeing where they're at and how they live and how we forced them to live is just a
Hmm.
straight reminder of that we did terrible things. And
Yeah, it's like this desire to hide the dirty laundry. And it's like you can't hide dirty laundry when the dirty laundry are people.
yeah,
Like, it's not how this works. Like, it's not like, oh, there was a fender bender I did when I was 18. Let's just like not talk about that. No, you fucking slaughtered people and forced them to be, into quote unquote Christianity for whatever fucked up reasons.
yeah,
And then you like tell them where and how to live, and then you're like, well, all right, as part of the treaty we will take care of your health services, but then you just don't. Like, what sort of, anyway, okay,
yeah.
well,
And
I'm getting
that's
fired up, but
well, and
continue.
that's how often we constantly break the treaties, including to today.
Oh yeah,
As we build
absolutely.
pipelines through their communities, that we said we wouldn't do that, and you know, force other laws that they don't get to vote on, all sorts of things that are very
Trash,
un-American.
trash, trash,
Yeah.
trash, trash, trash. I hate it so much. Anyway.
So yeah, I wish I could point to you, like go give you a good number, and be like, this many people were infected and this many, are doing, but we can't even get that info because we're like, I mean, we'll get to them.
Yeah, and I mean they have some info, but
Yeah,
like you said,
it's,
it's not
it's not accurate.
all encompassing because of how underserved these communities are as far as health services. A lot of nonprofits have started taking on the responsibility and, helping with health services where they can. Some tribes have set up their own centers, and those organizations and those centers are not required to report in the same way and report the same data, so we just don't have a good idea of like an all-encompassing holistic number of what's going on in that community.
Hmm.
And like you said, there's the miscategorizing of people because people for some reason can't remember that there are indigenous people
Yeah.
like on the list. It's like, yeah, anyway. So I did see that the CDC really, gosh, oh, I'm so like, I must be tired or hungry because I'm real fired up. But anyway, the CDC released a study that revealed that American Indians and Alaska Natives, which is like the AIAN bracket of like these people
Yeah.
on a lot of government documents.
Hmm.
Um, but uh, they had 3.5 times more cases than non-Hispanic whites in 23 states when they did a study. And again, this is, of course, not a good number as far as capturing everyone, but based on the numbers they did have, that's what came up. Um, and additionally, those who tested positive tended to be younger, like under 18
Wow.
years old. Um, the CDC provided this was a release from the CDC, so I was like, hmm. So their language said the CDC provided more than $200 million in COVID-19 funding to Indian country, which supports tribes, tribal organizations carrying out COVID-19 preparedness and response activities, including surveillance, epidemiology, laboratory capacity, infection control, and mitigation. So you're like, oh, $200 million dollars to Native communities throughout the country. That's cool. And then you're like, hold on. This is our goddamn responsibility.
Yeah.
Like,
This isn't a
this is
present or a
this isn't
stimulus.
this is like praising me for paying my rent.
Yeah.
Like, no, do the thing. And $200 million dollars for the 1.5 million people that live on a reservation, and you want to do all those things that you just listed, you think that's enough? Do you know how much it costs to do these things? Like,
Yeah.
that is
Yeah.
pitiful. Yeah, I was like, oh, hold please. What did you say? Yeah, it's pretty weak.
It is.
Pretty weak.
I mean, it's unfortunately not surprising though too, because
Of course,
that's
yeah.
how our country has always treated them,
It's
unfortunately.
how we do.
So, yeah.
Yeah. Um I also saw on May 13th the American Medical Association published an article saying that the added burdens of chronic disease and persistent underfunding of the American and Indian health systems have put the nation's indigenous population at higher risk of poor outcomes from COVID 19.
Hmm.
Dr. Donald Warren, or Warna, not sure, uh, mentioned, quote, unfortunately, what little money flows into the Indian Health Service, IHS, which is that government organization that you were talking
Yep.
about, um, is spent on medical care, not public health programs. So it's like putting out fires, not building the infrastructure to help fires not happen.
Yeah.
Um, and then he said putting Native American populations at particular risk in a pandemic. Um, I did note, like, if you're interested in learning more about the challenges and ways to improve quality of care and outcomes in indigenous populations, there was a video on the American Medical Association website, so I'll put that link in our show notes if you're interested in hearing some doctors talk about what they're up against.
Hmm.
Um, it's just it's like everybody's saying the same thing, but nobody's doing anything.
Right.
It's
That's
frustrating.
unfortunately the wall we keep hitting in America and with our podcast of here's a
Yeah, it's
problem,
like,
but no one's doing anything about it.
yeah, Jesus, our podcast's like subtitle is like 99 problems. Like that's literally our podcast. It's just 99
Just
problems.
99 problems.
Here you go. Um and then I did also see this one article published by US News that was published on October 7th. Um and they wrote that American Indian and Native Alaska Natives are 5.3 times more likely than white people to be hospitalized, which is like, I'm sorry. Hmm?
Right?
Excuse me? Did you say 5.3 times more likely to be hospitalized? And I think that probably points to the underlying conditions. I'm not sure, but holy crap.
Yeah. That's
And then Navajo Nation was one of the hardest hit communities in the country, and it's the largest Native American reservation in the U.S. And the number of deaths increased 100 people from March to June, going from 148 to 248 people in that period of time. I don't know where it's at now.
yeah, honestly it was hard to find new articles or new information past August.
Yeah, yeah, it was like there's like a lack. It almost feels like a media freeze.
Right?
It's like, where's the information? So let me get into the better half of this conversation, which is what can we do?
Okay.
Um, the answer is simple. It's really work with organizations who are dedicated to helping Native American populations.
Yeah.
That that's what we can do. Um, so if you're available to donate, you can contribute to the COVID-19 Emergency Response Fund hosted by the First Nations Development Institute. The institute is distributing 100% of the funds to Native nonprofit organizations and tribal programs that need it most. Initially, um, the funds are being prioritized in high concentration areas such as California, New Mexico, the Pacific Northwest, New York, Navajo Nation, Hopi Tribe, and other hotspots. Um, there are other options as well, but I did appreciate they listed the following reasons for why it's important to donate. They said Native people are at serious high risk due to high rates of diabetes, heart disease, hypertension, and other chronic illnesses. they said 13% of American Indian homes lack safe drinking water and proper wastewater disposal, creating conditions where sanitary standards cannot be maintained. 16% of homes in tribal areas are overcrowded and multi-generational, making social distancing impossible. And I mean, that's in line with the long lasting housing crisis on reservations, which happens to also be the federal government's job.
Yeah.
But here we are. And finally, food shortages and logistics of accessing food uh, further threatens health and resilience in Native families. So those are all excellent reasons to get involved and help, because it's pathetic
Yeah, it
how
is.
the U.S. treats treats our native friends. So another group that is working to help is the Partnership with Native Americans, the PWNA organization, and they are collecting donations if you would like to give to an organization with boots that are actually on the ground. So I typically prefer to find people that are doing the work and help them. Um, and so they are collecting donations. They list that there is a shortage of healthy food, safe drinking water, healthcare, and stores in remote reservation communities. And the PWNA makes critical deliveries to Native families and communities to help them get what they need while travel restrictions are in place. So I think that that's really cool. It's really important. So that is another option if you're looking for a way to help. Of course, I recommend looking up what organizations and what communities are near you and see what you can do in your local area,
Hmm.
because really that's, I mean, if we're learning anything from 2020, that's what counts.
Yeah.
That's what's important. So, if you can if you can help the people near you, you help your community, you help your state, etc., etc. You make where you live, like you're investing in where you live, which is good.
Yeah.
So, ah, so many rants,
Yeah.
but I'm done now.
But yeah, do what you can, but also, there's still, the plight of the Native Americans, and it shouldn't be forgotten.
Absolutely. Yeah, it's really infuriating. And super tiny side note, what's even more infuriating is the lack like this apparent inability for communities of color to work together. Like there's
Hmm.
always this and I'm not even going to get started on white people, but like but there's always this like uh, the the situation that has been put in place in the US and many other places is this idea of scarcity of resources. Those resources are scarce for a goddamn racist reason,
Yeah.
but the scarcity of resources makes communities of color feel like you have to jockey for positions over other people. So there's so much anti-blackness, anti-Latinx, anti-everything in all the communities. It's wild to observe. I've just been seeing a lot of it lately, and it's so discouraging. And it's like, why? Like, I 100% want to help other people stand up and have a better opportunity at life, and I am not going to step on you to do it. Like
Yeah.
that it's wild. So it's like, all right guys, get your shit together and help out. And if you're tired of hearing it, then whatever, find another podcast. But and if you're white and you're like, how do I play into this? Just read a goddamn book.
Yeah.
Figure it out. There are many books have been published about, the role of racism and colorism in how all of this stuff works. Colonialism set this machine into motion, and we're living in it, and we're happy with, you might be happy with, where you live, the house that you have or apartment that you have, the life that you're building for yourself and your family, and that's great. But like, maybe think about the people that are struggling so that that can happen for you.
Absolutely. Yeah.
Okay, now I'm done with
Now we're done.
ranting. I'm very tired. I'm very grumpy.
Well, then we'll get you distracted by talking about our distractions for the week. What have we been doing? What
Distractions.
have you been doing to
Um,
distract yourself?
so working a lot. I watched the pilot of The Wire because I hear it's really good
Mm-hmm.
and maybe I should watch it. So, okay. I watched the first episode and I was like, "Oh, snap. This is going to get real." So,
Oh,
um that was something. I'm still reading. I dabbled in music a little, but mostly I've just been working a lot, which isn't very good distraction, but you know,
you got to do what you got to do.
got to do what you got to do. What about you? What are you doing for your distractions this week?
All sorts of things, I think. Um, a lot of videos. Last Tuesday, I ended up posting a video on every single YouTube channel that I run. And then I realized how many I got going. but
How long did that take you?
um, not terribly long to do the actual uploading.
Oh,
But
okay.
yeah, I did a batch produce. I compiled all the videos I made all in one shot, and that I just had to have my computer run it overnight because that's how long that took.
Oh, yeah.
So a lot of that. Watching Star Trek Discovery. Jonathan Frinks is directing next week's episode or this week's episode. Can't remember, but it's coming up soon.
Who's that?
Number one,
John.
Riker.
Oh, is he. Wait,
Yeah,
really?
Riker's going to be directing
That's
an
his name?
episode. Yeah, yeah,
Huh.
Jonathan Frinks.
I thought his name was totally different than that, but okay. Cool.
So that's been fun. It's been a really good season. Caught up on The Mandalorian. Um,
Yeah.
that's been really great this season. Also, I found out how, because of an interview about The Mandalorian, I figured out how Jon Favreau says macaroons, and I hate it, and I think it's worth mocking him for it. He says
Okay.
macarons.
Oh, he says macaroons for the French macaron?
No, he says macaron instead of macaroon. It's macaroon for the cookie.
No, it's
It
not.
is.
A macaroon has coconut in it and it's gross, but a macaron is a macaron. It's French. That's how you say it. They came up with the word.
I disagree. It's macaroon.
Ew. Gross. Colonization, people. Colonization.
I've never heard it ever said macaron before in my entire life.
Wow, that is 100% how it's supposed to be said and how everyone says it, except for, like, in my opinion, rednecks that don't know that it is called macaron. But even Cajun rednecks know how to say it because they speak French.
But they should be saying macaroon.
Oh
See,
my
that's more French.
god. I'm gonna throw myself off a cliff over this conversation. Just this one. All the other stuff was fine, apparently. But I will. Oh man, you're on thin ice, dude.
So yeah, that's been my distractions mostly. So good stuff.
Huh. I need to reevaluate all of my friends.
Ask
I'm
them
gonna
how
do
you
like
say
a
this word.
Instagram like poll to see like who is it of you that I need to have a talking to.
How do you say this word?
How do you well, no, it's not how you say this word, it's what do you call this thing?
Ah,
What do you call the coconut gross thing? And if you say macaroon, I'll be like, yes, that's right. That is a macaroon and it's gross. What do you call delightful little delicate sandwiches with delicious jelly in the middle? And you say macaroon, and I say, get the fuck out.
and it's not jelly in the middle. It's a meringue that's in the middle.
It is a meringue, but sometimes they put
Okay,
jelly.
that's fair. Still macaroon.
No, no, that's wrong. Literally, the people that make it don't call it that. So I don't know how to help you. You're just wrong.
So let's move on to our favorite part of the podcast. Only in a pandemic.
Major civil unrest.
Stories that can only happen in a pandemic or major civil unrest. You got a story for us?
Yeah, yeah, I do. Only in a pandemic do you experience multiple emotions at the same time daily.
Only in a pandemic, though? Because I've known you for a
Yeah,
while. Yeah.
well, no, I feel like in normal times, yeah, I can have like multiple, but like I feel like in a pandemic, you just keep seeing things that make you feel multiple things. I think I've talked about it before where
Mm-hmm.
you're like, you see like a parade and then you're like, hey, and then you're like, oh, everybody's gonna die. Hey, and it's like always both sides of the spectrum at the same
Yeah.
time. So this week I saw we there's a testing center that they just like a drive-through testing center thing that they just set up in the parking lot of a baseball diamond, like the local baseball stadium.
Mm-hmm.
And I was like, "Oh, that's really cool use of space. Um, that's so smart." And then I saw all the cars and I was like, "That is depressing that that many people want tests. But this is good, but this is bad. But this is good, but this is bad." It's just it's constant, and I feel like an emotional yo-yo, but I mean, that's not new, but I figured I'd just name it.
Yeah, that's fair.
What about you? What's your only in a pandemic story?
Only in a pandemic do you have to make a plan and figure out how you get new plates during a pandemic.
New plates?
Plates for my car, I should say. Specify that.
Oh. Yeah, yeah, that was exciting. I had to do the same thing earlier because new state and all,
Yeah.
but yeah, it was a shit show.
Right. So yeah, they
How was it in Colorado?
yeah, they stole my plates. So I need new ones. And
Mm.
it depends on the county. I'm in Arapahoe County, which apparently doesn't have their shit together as much.
Oh no.
I had two options. I can set an appointment because they're only doing by appointment, and those are 4 weeks out.
Oh.
Or we can do a weird drug drop style where I fill out a form, put it in an envelope with a cover letter, the information about my car, and a money order for the price of the plate, put that in their Dropbox. They call me later and say, hey, you can come get your plates.
Whoa. Okay.
Yeah, it's a.
Ye That is pretty wacky. That's so weird. Like what what Virginia did, which I mean, of course I was in a totally different situation. I had my Colorado plates, but they had
Mm-hmm.
expired and they closed all the DMVs. So I was like,
Yeah, what do you do now?
well now what? And so essentially what they did is that they just didn't enforce retired tags
Okay.
until like I don't even know when the end date was, but so like when it reopened, then I made an appointment, which was yes, 4 weeks from that time that I was making the appointment. So I renewed my tags like 6 months late.
Jeez.
But yeah, it was crazy. I mean, I'm not even renewed my tags. I got a new license
Yeah.
plate, but for you, it's like totally different. You don't have any
Yeah, I
tags.
don't have anything. Like, they're like, can you put a copy of your registration with it as well? It's like, no, unless they left that in the car, that's long gone.
Oh, Jesus Christ. That sucks.
And
So now you have to talk to the Colorado. Oh
now, as
man.
long as they
That's
have
so
my VIN
shitty.
and the old license plate number, which I do have, they should be able to pull up the info, they said. So, but
Yeah, but still, like, I would still want a copy of my registration.
yeah. Yeah, I didn't.
So then you have to jump through a bunch of hoops to try to get that.
Well, when I get the new plates, I have to get a new registration anyways because the
Oh,
plates
yeah.
have your registration. So they're gonna print that out
Right.
for me anyways.
Right, right, right.
So,
Yeah.
but yeah, if I was in Denver County, you fill out the form online and they actually just ship you the plates.
Man, I like when I lived in Denver, shit was awesome. Like that Denver County just has their shit together. It was so
Yeah.
nice to just be able to do everything online. Everything was timely. Everything just the system works. but then you move out of Denver County.
And I'm not even out that far out. Like across the street is a Denver County from me.
Oh, I
Across
know
the
you're
street
not. I
both
know. Like
ways.
you are literally like one step away from Denver County, but because of that one step, fuck you
What
apparently.
an important step. Yeah, but it gives me
At
a
least you know what county you live in
yeah,
now.
that was fun times. Um,
Living in a weird triangle of countyless land.
right. Yeah, so what we're referencing is when I had to get my plates when I moved and had to do an address change and all that. I went to a Denver County place. I was like, oh, I only moved across the street. I don't really need to do a whole lot. And they're like, yeah, we can't help you here. And I had to figure out, I had to go to a completely different DMV, and realize I'm in a completely different county. It was an experience. It was crazy.
Oh Lord.
Anywho's, I think that'll wrap it up for a show. So let's do our hermit level before we call it good. So on the Leonardo DiCaprio scale of a 10 being, let's go with Howard Hughes and from The Aviator, and you're living in an enclosed theater and you're not seeing anybody for months on end, or a 1 being Jack on the Titanic and you're dancing with all your peeps down in the second tier and there's no social distancing. Where are you at?
I think I'm like when you said you live in a theater and you're not seeing people, I was like, well, my TV is big.
Yeah,
And I do have it hooked up to a sound system. So maybe I do live in a
a little
theater.
bit.
But yeah, I'm still a 9.5. I'm like I have to leave to go to work, but that's the only people I have seen was when I had to go teach class. Otherwise, I am a shut-in 100% and I am okay with that. What about
I'd
you?
say about an 8. A little bit lower.
Okay.
We did have band practice because
Oh yeah, that's right.
no one's had any symptoms and no one's family that they've been around has had any symptoms for 2 weeks. So
Mhm.
we figure we're good to practice. So that was about it, though. I haven't seen anybody else since. I work remotely, I do everything remotely, and I went to the grocery store. That was my big outing.
Grocery store. Yeah.
So
Oh man, I need to do that. I have no food.
that's bad.
Oh well.
So yeah, I think that'll do it for another episode. So if people want to hit you up and say what's going on, Luna, how can they do that?
They can find me at Luna underscore Minuit, it's LUNA underscore MINUIT at Instagram and Twitter. And you can find us at Goth and Sloth on Instagram and Twitter as well. And you can email us if you have any wonderful ideas for topics. You can email us at gothandsloth@gmail.com. And where can people find all the things you do,
All
Matt?
the things. I'm wizard underscore Matt on the Twitters, wizard cosplay on the Instagram. My YouTube channel is Matt the Feral Wizard. I just came out with a video talking about Black Canary and the history of it. Highly suggest watching it because her history is insane and it's hilarious and great. My band is Leonardo, and we are Leonardo Band on SoundCloud and Facebook. We're gonna have a sort of music video coming out on Monday, and I think that's all the things.
Woohoo! You
We
did it.
did it.
All right, you guys, thank you for listening as always, and please wash your
And wear your
hands.
mask.